Hello, how are you? If you're just joining my channel for the first time, my name is Linda and I'm a healthcare professional. I'm here to bring to you health lessons and I try to do that at least once a week. And my lessons are conducted in English language and then at the end I'll summarize in Igbo language. Igbo is a tribe in Nigeria and Nigeria is in West Africa. Now, today's topic is going to be leprosy. Leprosy. Yeah, we've been hearing, just globally, cases scattered here and there, so once in a while we'll hear that, it could be passed from human to human. Sometimes humans can get that from armadillo, that animal called armadillo. So now, I remember a long time ago, growing up, so we had this relative, like a distant relative, and beautiful lady. They said she had leprosy, and her digits were all gone, and she lived in isolation. Even after being healed of leprosy, that stigma, people still just, it's almost like you looking at leprosy when you see her. And I was young that time, very young, but I could just feel it. I could remember how people would be talking about her, that she had leprosy. Now we have no idea where she got that from. So leprosy, also known as Hansen's disease, or in Igbo is called Ekpenta. I know I will still go back to Igbo language, right? So it's a disease that could be, it's usually caused by a bacteria, Mycobacterium leprae, okay? And like I said, it can be spread from human to human and people can get it from armadillo. But before someone can get that, they must have stayed in a very close contact for someone with an untreated leprosy, and they must have been in contact with that person for a long period of time. It's not a disease that could just easily be passed on from a person to person, not by just hugging, not by sharing food, not by just saying, or just staying with that person for a moment. You must have actually stayed with that person for a long period of time. And actually, if someone is healed of leprosy, or as soon as they start treatment for leprosy, they won't be able to transmit it to someone else. Usually it's not transmissible at that time. So what can you see, okay, that could tell you, maybe. So the person may have like light colored or reddish skin, like patches, and loss of sensation in the skin lesions. Okay, so they may have dry hairless skin or not just, or thickened skin. So that may happen. All right. So what are some of the risk factors, like I said before, living in, with someone with untreated leprosy for a long time, okay, or in areas affected, with leprosy. I remember too, when they have a place, just for people that have, leprosy, in Nigeria. So I remember that as a kid. I remember them talking about that. So this leprosy can affect the nerves. It can affect, the peripheral nerves. So it can cause, like numbness in the hands and then the feet. All right. It can also cause tingling, muscle weakness, those things. Then also like loss of pain or sensation, in that area, even feeling of temperature, that may be difficult to see. And they may have dry eye, difficulty blinking, so they may just have like vision problems. So, and as the disease progresses, they may have like deformities, okay, of their hands and their feet. All right. And then treatment. Okay, so the World Health Organization recommended multi-drug therapy. Okay, so some of those medications will be rifampicin, okay, dapsone, and clofazimine. Okay, clofazimine. So they may use that. So it's important to get treatment as early as possible. Take care of the wound if the person has wound. Take care of that wound. Okay, as good as possible, and as quickly as possible. All right, so that will help. All right, so again, the treatment, multi-drug therapy is usually efficient. Okay, rifampicin, dapsone, and also clofazimine. And some people also have like a natural immunity to leprosy, so even after being exposed, they may not catch the disease. All right, so that's all I have for you for today. Now I'm going to switch to Igbo language, and don't go anywhere because I have a song for you and I'll use an instrument. Okay, all right. Ndewo 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 ndị nke m. So ihe m chọrọ ịgbata ụkwụ na ya taa bụ ihe ahụ ndị Igbo na-akpọ ekpenta. So echetara mgbe gboo, aka dị m obere mgbe ahụ, ụmụ nwaanyị onye ikwu n'ibe asị na o nwere ekpenta ahụ, ọmarịcha nwaanyị na asị na o nweghị ahụ. Mgbe ahụ ọ lachakwala, betin still ị ga-ahụ na ndị mmadụ ka nakwa asọ onye ahụ asọ, ya dịka onye ahụ obiri onwe ya, ndị mmadụ a na-emekọrịtacha wito onye ahụ, amakwa m ebe o si bute ihe ahụ, betin mgbe ahụ anyị ka dị obere. So mmadụ nwere ike ibute mmadụ na mmadụ, anụ ahụ a na-akpa amadilo, but before mmadụ ebutekwana ya, ị ga-anọ wite onye nwe ya, onye ahụ nwe ya, bet o nwetaghị ọgwụgwọ. Ịghọtala? So ọ bụrụ ịnọkwuje onye ahụ nọtee aka, ọnwa na ọnwa na ọnwa na ọnwa na ọnwa, then onye ahụ nwere ike nweta ya. Ọ wụghị ihe mmadụ ga-ajọs nweta because na ị nara mmadụ aka, maọbụ na ibere mmadụ ọma. Ịghọtala? Ma ọ na gị na mmadụ nọ rikọta nri, mba, ọwụgo otu o si efe. Ịghọtala? Ọwụgo otu o si efe. And o nwere ike imetụta mmadụ ahụ ya dịka aka na ụkwụ na-erijisi, ọ gaa na-efe ilicha ụkwụ ya na aka ya. Then o nwere ike metakwa anya mmadụ, nwere ike kọsọrọ mmadụ, kpatara mmadụ nsogbu anya, even ime otu. Ịghọtala? Ịkọ anya bụ otu ga na-arụ onye ahụ. O nwere ike metacha ebe imi. So mmadụ nwere ike zie umere. Ịghọtala? Mmadụ enweta ya from umere ahụ, maọbụ na o ziri ndụ. Ịghọtala? Onye ahụ enweta ya otu ahụ. Again, ọkwa m onye ahụ were nọtee aka witi onye ahụ o mere na-enwetaghị ọgwụgwọ. Ịghọtala? So otu mmadụ ga-esi, ọ bụ na ịnọ ebe ọrịa ahụ juru, then ọ nwere ike onye ahụ enweta ya. Ịghọtala? Enwere ike onye ahụ ya bịa nwechaa ka o nwe patches, ihe tụkasịcha ya n'ahụ, ihe atụkasịcha ya n'ahụ, so enwere ike ajị ahụ apụsịcha ya. Ịghọtala? Then o nwere ike ọ gaa akụkụ ahụ ya ebe ụfọdụ eme ka ihe kpọnwụrụ akpọnwụ, like ọ gaa ihe ya imetụgodi ya ka ọ gaa na-emetụtacha ya nke ọma. Ịghọtala? So o nwere ike ịkọsọ mmadụ anya mgbu, ụkwụ ya dịka ụkwụ eribisi ma mkpụrụ aka. Ịghọtala? So ọ bụrụ na onye o mere onye nweta ọgwụ ọsịsọ, ndị World Health Organization nwekasị ọgwụ ha si dị mma inye mmadụ, nyekọta ọgwụ ahụ, beta onye dibịa ga-enye n'aka mara nke karịa onye ahụ mmụọ. So ụfọdụ ọgwụ ahụ ha kpọrọ aha onwe nke a na-akpọ rifampicin, dapsone, nke clofazimine. Okay, so ihe abụgasị ọgwụ ndị enwere ike inye onye ahụ. Now aka m gakwa sụgharịa n'okwu bekee maọbụ okwu oyibo. Okay, so I'm back to English again. Remember, someone can get leprosy, after staying with someone that has leprosy for a long period of time, someone that has leprosy that didn't get treatment. So if you stay with that person for a long time, the person maybe through sneezing, someone can get that too. All right. I think I will stop here. It's not a very long lesson. All right. So that's what it is. But education will help. Knowledge will help to reduce the stigma, so people just don't get it like that, And this is a disease that someone got from, maybe it's from someone or people that come in contact with maybe armadillo, because you can get it from that animal too. So, so a lot of education can help, and it will also help the patient, to reduce anxiety and, reduce that stigma. All right, and just help the person and let them seek for treatment as early as possible to prevent all the complications. All right, thank you for listening. So the Bible verse for today, I'll read it for you, is Psalm 103 verse 1. Bless the Lord, O my soul, and all that is within me, bless his name. That's the Bible. Now, I'll teach you 2 Igbo words. 1, disease. Disease, oria. 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 I'll spell it in English. O-R-I-A. Oria. I'll spell it in Igbo now. O-re-e-a. Again. O-re-e-a. Oria. All right? Oria. That's disease. The second Igbo word will be hand fan. And I have one here. This is let's see. This is made in Igbo land. This is a hand fan. Isn't it beautiful? Look at that. It's beautiful, nice, and lightweight too. So that's called akupe. Akupe. I'll spell it in English. A-K-U-P-E. I'll spell it in Igbo. A-K-O-P-E. 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 Akupe. All right. So the song for today, it's saying in English, the one who does good, please receive thanks. And that's God. All right. The one who does good, receive all the thanks. Now I'm going to sing it, and you can dance too. All right. Selecting my instrument. I think you already guessed which one because you can hear it. Yep, that one. All right. O mema na rekele dema. O mema na rekele. O mema na rekele dema. O mema biko na rekele. O mema na rekele dema. O mema na rekele. O mema na rekele dema. O mema biko na rekele. O mema na rekele dema. O mema na rekele. O mema na rekele dema. O mema biko na rekele. One more time. O mema na rekele dema. O mema na rekele. O mema na rekele dema. O mema biko na rekele. All right. If you know the song, join me without the instrument, and you can dance. All right. O mema na rekele dema. O mema na rekele. O mema na rekele dema. O mema biko na rekele. O mema na rekele dema. O mema na rekele. O mema na rekele dema. O mema biko na rekele. All right. All right. This is the end of today's lesson. All right. So, do you remember what we say in Igbo when you want to say goodbye? You want to try? Ka emesia. Ka emesia. All right. So I'll see you as soon as possible. All right. Keep tuning in to the channel. And if you like, please share and subscribe. All right? Take care. Ka emesia. Bye-bye.